Good morning. Welcome to this week's episode of Tooth Teacher Tuesday. As always, I am your humble host, Dr. Stephen Zom. I hope everyone here stateside had a wonderful long Memorial Day weekend, some good relaxation and time in the sun. And without further ado, we'll jump into today's topic, which is our final episode discussing dry mouth, specifically talking about what are treatments for dry mouth. You know, we know what causes dry mouth. We know what can happen if dry mouth is left untreated. So let's get on with it. What do we do about it? And the answer isn't as simple as we'd like it to be, because a lot of times treating dry mouth is going to depend on what is causing it. One of the main things we talked about being a cause of dry mouth is medications. And, obviously, taking you off the medication that's causing the dry mouth is usually not an option. And, one form of treatment for dry mouth is actually having you take another medication that is specifically for increasing your salivary flow. The problem with that is that your other medications are causing dry mouth for a reason, and putting you on the medication that increases saliva flow a lot of times counteracts the effects of the medications you're already taking. So it's basically a zero net game. That's in rare cases, medication to treat dry mouth is going to be helpful, but most of the time it's just going to interact with your other meds and create further issues. So if that's our reason for dry mouth, and oftentimes it is, prescribing another medication isn't going to help. It would help in the event that dry mouth is just due to age, but otherwise, whether it's medications, blocked salivary glands, Sjogren's syndrome, a lot of the other reasons we talked about aren't going to be treated with a saliva stimulating medication. So, in that event, our other options are basically using some kind of product, and there is a vast multitude of products out there, but some kind of product that's going to basically encourage saliva flow that's not a straight medication. What I mean by that is there are a number of brands and different forms of products out there designed to treat dry mouth that come in the forms of different mouthwashes, gums, mints, lozenges that are all sugar-free, but basically is something in the mouth that is going to trick your brain and therefore trick your salivary glands into producing more saliva. Probably the most notable, the one that most of the public is going to recognize, is Biotene, which is a mouth rinse that is intended to stimulate the salivary glands. And but as I said, there are a multitude of other brands and forms of products that are out there. I would say probably another one that I particularly like, and as always, I have no conflict of interest or sponsorship of any kind, but Xylamelts are a brand of mint that basically suck on like a lozenge, and it's designed to stimulate saliva. Had a lot of good feedback from patients that they find this helpful, but again, there the same product exists in other brands as well. But again, with any of these products, there's limits to how much they'll help, especially depending on the cause. This will help in the event that dry mouth is from medication or age, but if it's due to Sjogren's or blocked salivary gland, there's only so much it can do. So on that subject, I guess specifically with Sjogren's, treatment is kind of limited because the body's attacking the salivary glands. It's kind of hard to get things back up and running, so to speak. So immunosuppressants, like most autoimmune diseases, will help, but again, that's another medication that's going to have other side effects. So Sjogren's is, take-home message, Sjogren's is very difficult to treat, as anyone with Sjogren's will tell you. And then in the event of a blocked salivary duct, trying to produce more saliva, whether it's from a drug or from a product, is not fixing the problem, because if you think of a garden hose that's blocked, the water just backs up. So turning the faucet up higher, producing more saliva, is not going to help. In the event of a blocked salivary duct due to a saliva stone, if the saliva stone is small enough, it'll clear on its own. But if it's big enough and it's lodged and it's not going anywhere, then surgery is going to be necessary to remove that stone and open things up again. Beyond that, those are going to be your typical treatments for dry mouth. Aside from, I think anyone with dry mouth will tell you that glass of water, bottle of water, any kind of water is their best friend. Just keeping it handy at all times, just again, to keep things moist, keep things lubricated, because otherwise it's just dry and uncomfortable, even if they are using other forms of treatment. So water is definitely the most helpful thing for dry mouth of any cause. So covered a lot of ground, talked about a lot of different things. I'm going to go ahead and wrap up at this point, but hope this information is helpful and will help anybody that's suffering from dry mouth. As always, check with your dentist, get more information about what could be causing your dry mouth if you're experiencing it, and they'll be able to recommend the appropriate treatment from there. So thank you for tuning in, and I hope you will tune in the future for more episodes of Tooth Teacher Tuesday. But until that time, have a great week, everyone.